Thank you for taking an interest in learning about the educational resources that go along with our Identify, Isolate, and Inform toolkit. If you have not done so, go to www.mypac.us to familiarize yourself with the other items in the toolkit. This tool is designed to be used in collaboration with the others presented in the series to create a comprehensive approach to the early identification, isolation, and notification of patients with or suspected of having a high-consequence infectious disease. In this video, we will focus on how to use the Epidemiological Risk Screening Questionnaire. Please note, additional educational resources are available to help you understand and operationalize the entire Identify, Isolate, and Inform algorithm. The Epidemiologic Risk Screening Questionnaire will help clinicians further assess a patient who has a positive travel or exposure screening and is symptomatic. Using this template will allow you to have a snapshot of the clinical history of the patient and have all the pertinent information you will need to share with your leadership and external stakeholders, such as your local health department or your site's infection prevention and control team. Now, let's take a closer look at this double-sided questionnaire. Step 1 and 2 are fairly straightforward. In Step 1, you will select if the PUI is suspected of having a viral hemorrhagic fever or respiratory pathogen. In Step 2, you will complete the patient's demographics, paying close attention to the time the patient presented and the time the patient was isolated. In Step 3, fill in the country or state the patient has traveled to. Using the country list of outbreaks of interest could be useful here to see if the country or state traveled to by the patient is on the list. In Step 4, you have two pathways, one for a suspected VHF patient and one for a respiratory patient. If your patient is a VHF PUI, then proceed to complete the lower half of the first page. Once again, you want to make sure that all areas are filled in. If the patient is not suspected or presenting symptoms of a VHF, then you can move on to the highly pathogenic respiratory infection assessment section. If you are filling in 4B, the same principles of 4A apply. The more information you provide up front, the easier it will be to report out to all the stakeholders involved, and to any potential clinicians when handing off the case. Step 5. If you discharge a patient home, refer to the outbreaks of concern to assess epidemiologic risk. Based on the patient's isolation status and public health guidance, remember you could speak to the patient via their cell phone to get much of the information on this form. Lastly, at Step 6, you will add any relevant information to the case. Thank you for watching this educational resource. Please be sure to see the videos developed on each of the other tools in the series.